British and European regulators have found a potential link between the AstraZeneca vaccine and rare blood clots. But officials are stressing the benefits outweigh the risks for most people.
These vaccines are safe, they've saved many thousands of lives, and people should come forward to get their jabs, and we'll make sure that they get the right jabs.
Now, under 30s in the UK won't be given the AstraZeneca jab.
This is a change in clinical advice for the under 30s. It will require some changes in the way that the National Health Service operationalises the vaccine rollout programme.
79 people suffered rare blood clots in the UK after vaccination. 19 died.
This is an extremely rare adverse event. We do not know for sure that it's related to one vaccine or not yet. It may also be relevant to some other vaccine. It may not even be related to a vaccine. It may be related to COVID itself.
In the UK, they've had about 70 to 80 cases of this rare clotting disorder, but at the very same time, they've also had plummeting numbers of COVID cases and COVID deaths. With tens of millions of vaccines delivered, particularly in the UK, that they're understanding the incidence of this rare clotting disorder. They think it probably has a link to the AstraZeneca vaccine. Cannot prove absolute causality, but that said, they're trying to help an anxious population understand the risks and benefits of vaccine.
Data from the European Medicines Agency suggests the risk of blood clots is potentially as high as 1 in 100,000 people.
Most of the cases occurred in individuals below 60 years of age and in women. But because of the different ways the vaccine is being used in the different countries, the committee did not conclude that age and gender were clear risk factors for these very rare side effects.
Officials are urging confidence while waiting for further medical advice.
AstraZeneca vaccine is extremely effective and very safe for most people.
Let's note that in the UK, the advice is that some 6,000 people's lives have already been saved by this very vaccine.
I'm one of the thousands that have had the vaccine and have not had anything adverse, but of course we need to rely on the health experts.
For us here in Australia, with AstraZeneca as our principal vaccine source, we need to understand where the risk-benefit equation lies. For the vast majority of us, the benefits remained absolutely profound. The risk of this rare side effect is even, I think, less common than being struck by lightning or being taken by a shark. But our expert advisory groups, the TGA and ATAGI, need to assess this and advise on what it means for the population.